Good morning and welcome to the Thursday, April 1st COVID-19 response media briefing. I'm Corey Portner, your facilitator today. I'd like to welcome our panel. From the Washington State Department of Health, we have Dr. Umair A. Shah, Secretary of Health, Michelle Roberts, Acting Assistant Secretary for the Division of Prevention and Community Health, Dr. Scott Lindquist, Acting State Health Officer, Lacey Fehrenbach, Deputy Secretary for the COVID-19 response, and Dan Laster, Director of the Vaccine Action Command and Coordination System, VAX Center. To begin today's briefing, we'll open with remarks from Secretary Shah.
Thank you, Corey. And you can hear me okay, Corey?
Yes, sir.
Great. Well, thank you everybody for joining. Again, I want to welcome you to our weekly briefing. We are beginning a new month, and it's April 1st. As you know, some people call it April Fool's Day. Unfortunately, we are still in the midst of a pandemic, so there's not much comedy this morning. We want to continue to make sure everybody remembers that we're in the midst of a pandemic, and that pandemic means that we have to continue to do everything we can to fight this pandemic. We're at a very crucial time as far as cases go. We want to do everything we can to help prevent a fourth wave, which is something I'm going to talk about. I also want to talk about gatherings and the importance of being safe during gatherings. And I really want to also recommend and talk through about behavior and the sense of urgency that we need to continue to have. So let's dive into a couple of those themes. Before I do that, I do want to follow up from yesterday's press briefing with Governor Inslee. And just a reminder that yesterday we had a whole host of people that became eligible for vaccine in the state of Washington, which Michelle Roberts is going to describe. And I think that has been fantastic because that is something that continues to show us that we're making progress and we're moving in the right direction. We also know that April 15th, we announced yesterday that we're going to open up vaccination eligibility for all Washingtonians age 16 and above. And I do want to also recognize that's usually, this year being a little bit different, that's usually tax day. So I'm going to give a shout out to Chris Daniels on King 5 for saying that tax day is vax day in the state of Washington. And while we are excited about that and we absolutely want the progress to continue to be in the right direction, we do recognize that we don't have the supply quite yet. So we're going to be able to provide vaccines to everybody in the state of Washington on April 15th, of course, but we are making progress and moving in the right direction. So I wanted to say thank you, Chris, for that. And I saw that on Twitter. So here are a few things that I wanted to talk about. Again, the progress with respect to what's happening related to vaccines. And I will be talking about this from the vantage point of the three-legged stool concept that I've mentioned a few times on previous briefings. And in fact, after Michelle makes her remarks, I'll come back to it. And remember, the three-legged stool was about vaccine supply, vaccine logistics and administration, and vaccine demand. And all three of those need to be balanced. So we'll show a graphic for that. Again, the reminder that we are on April 15th, essentially the 4-month anniversary of the rollout of vaccines in the state of Washington. And to date, we have continued to focus on those most at risk. And as I mentioned yesterday, it's not just the 4 months of history that we're looking back on, but we want to look ahead from April 15th forward, the 4 months ahead, and the road to continue to vaccinate Washingtonians above the age of 16, but as you know, 16 and above, but also we had some promising news also yesterday with Pfizer vaccine potentially being in the mix for being approved for a younger population, which again, Michelle is going to be able to describe. 1.3 million people fully vaccinated in the state of Washington. That represents about 17% of our population. Our current 7-day average is almost 56,000 vaccine doses every single day in the state of Washington. And I can't speak enough about how important it is to remember the journey that we've been on. That January 3rd, we were at a point where 29% of all the vaccines that were coming into the state of Washington were being administered, and now we're well into the 80%. In addition to that, at the time we set our goal a few months back, we were at about 12,500 or 13,500 vaccines a day. And we set an ambitious goal of 45,000 vaccines a day. And here we are, that we have now been able to exceed that. And that is a testament to all of our partners on the ground. And I want to thank everybody in our local health jurisdictions, our tribal vaccine partners, all of our healthcare system, pharmacies, community health centers, and all the private sector that have come together, and so many other partners that I haven't even mentioned who have just been there, but most importantly, our community members for doing what they can to be able to vaccinate and get vaccinated. One other piece that we emphasized yesterday, and I want to make sure to continue to underscore, is that while we have on April 15th, we're going to be opening up eligibility to a broader group of people. We want to continue to emphasize those people that we are concerned about that have the most risk, and that includes seniors. And so I want to just again underscore the plea from yesterday. We have made a tremendous amount of progress with seniors, but we still have 300 and some thousand seniors who have still not been vaccinated. And we want to make sure that we do everything we can to help them. And as you know, we've put in a lot of resources to be able to have online technologies so people can sign up for appointments. And Dan Laster is on, he can talk about that as well. I do think it's absolutely critical that we recognize that there is another way for seniors to sign up or others to sign up, and that's by calling our state COVID-19 assistance hotline, which to date has scheduled over 25,000 appointments in the state of Washington. That phone number, and we would ask our media partners to really champion this phone number on any of the material and any of the messages that you put out there for the community, is 1-800-525-0127, 1-800-525-0127. And it has multiple languages, and really it is an incredible resource for people to be able to use an alternative means to be able to sign up to either get appointments or to understand where appointments are available in their neighborhoods. I don't want to just focus on seniors, although seniors are absolutely critical. We want to focus also on anyone who needs assistance in getting vaccinated. And we're going to really, again, plead to all of you, if you're, in a population that's not quite yet eligible, but somebody who has not been vaccinated or somebody who's not sure about getting vaccinated, we'd ask you to talk to them, encourage them, check on them, see why they're not getting the vaccine appointment, see why they've not made the call or gone online. If you need to, drive them to a site that is actually providing vaccines. We have some great news that we're going to highlight even further next week, which is including Sound Transit in Pierce County, where they have free transportation to get to vaccine sites. This is just incredible in the ability for the private sector and the public sector to come together to do whatever we can to help get Washingtonians access to vaccines. So that's good news. This is all good news, but we do continue to worry, and Dr. Lindquist is on, as is Lacey Fehrenbach, and they can both speak to this as well, that we are concerned about transmission. Disease transmission is increasing, and we are seeing concerning signs. Modeling based on the data through March 18th shows that transmission is increasing. The statewide case counts and hospital admissions, as you know, as we came off the third surge, that third wave coming down, it was really coming down very nicely. And then it started to plateau as of mid-March. And so in the most recent data, the case counts are showing increases in King County, Pierce County, Snohomish counties, for example. And what we want to do is remind everybody that we are not out of the pandemic until we are out of the pandemic, meaning do not let your guard down. A growing proportion of cases are B117 strains, which, as you know, are more transmissible and potentially may cause additional concern for illness. We estimate that these will be more than 50% of the cases by mid-April in the state of Washington. And further, it's not just seniors, and it's not just the people that we oftentimes focus on when it comes to disease transmission. It is also those members of our communities who are age 20 to 39 are seeing the highest disease activity and the least percentage of vaccines to date. And that is also something that we want to continue to address. So if you are in the ages of 20 to 39, or frankly any age, and you are engaging in those behaviors where you're thinking that we're out of this pandemic, we are not. And these are concerns that are now happening not just in communities across Washington. This is happening in communities across the country and communities across the globe. And so it's absolutely critical we continue to stay the course and do everything we can to make sure we fight this pandemic. And again, what we don't want to see is that flattening and plateauing to start to uptick or increase, and that we're back at it in a fourth wave, and we are unfortunately then having to resort to additional measures to fight this pandemic. I also want to remind people that virtual gatherings and delaying travel are still the safest for upcoming holidays. And we have a number of holidays and celebrations and events that are coming, everything from Passover and Easter and Ramadan. And, we will also have schools that are going to be closing soon with their graduation and other kinds of activities. We also more immediately have the Final Four this weekend. And I do want to make sure that people are recognizing that. Obviously, we've got a team in the great state of Washington in the Final Four. We also have a team two from Texas. I just wanted to put that out there. But it's really important that as people celebrate, and hopefully it's a Gonzaga victory for all of it, and to be national NCAA champion. But if that does not happen, or whether it happens or doesn't happen, we want to make sure people celebrate responsibly and carefully, and remembering that we're still in the midst of the pandemic. So that's one message for you, but the other message is really about spring break. And we do know that people are going to travel, but we want to remind people that staying home is the safest for family and schools and communities. But I do want everybody to recognize that even if you do travel, we need to make sure you're doing everything you can to take the preventive precautions, including wearing and especially wearing of masks. If you do gather, do it outdoors if possible. Increase indoor ventilation. If not, wear masks, watch your distance, and limit the gathering length and size. And I do want to say the other piece of this is really about vaccinations, and really what you can do if you're vaccinated or not. And so if we can show the graphic, that just because you're vaccinated doesn't mean you can gather completely safely. We want to make sure that it's more than 2 weeks after you complete vaccination. And we want to also avoid gatherings if you are in a household where there's a household member who is at high risk or higher risk for COVID-19. And so this graphic shows you some of those things, and Dr. Lindquist or Lacey can describe some of these if you have any additional questions. But we have this on our website, or are about to put this up on our website, and it really shows fully vaccinated what people, per the CDC recommendations, what they can or should be able to do compared to those who are unvaccinated or partially vaccinated. And I think the key message is, and the way I've been describing this, is that this is version 1.0. And this is because we, across the state of Washington, although we've made a tremendous amount of progress, 1.3 million people who have been vaccinated, this is still with a limited amount of our population vaccinated. I believe there will be a 2.0 and perhaps a 3.0 or a 4.0 from the CDC as we get more vaccine coverage and we get more vaccine experience, that you're going to start to see some additional guidance on what people can or should do if they're vaccinated, and what they can or should do if they're not vaccinated. So I wanted to make sure to show this graphic. And again, I want to thank our team for putting this graphic together, which I think is going to be very helpful. Now, with that, let me close by saying that we've made a tremendous amount of progress in vaccines. I want to thank our public and private sector partners, everything that everybody has been doing. I want to thank Dan Laster and the VAC Center and his leadership and what his team have been doing. I want to thank our team here. You sometimes just see Dr. Lindquist or Lacey Fehrenbach and Michelle Roberts or myself, and we represent a whole host of people at the Department of Health who every single day, night, weekends, holidays are doing things on behalf of Washingtonians. But guess what? That's what's happening across the public health system and the healthcare system within the state of Washington. But we need your help. We need your help. What we're asking you to do is to continue to work with us. This is not a time to let down your guard. We know that we're in a very important place. Vaccines are coming. We know that's going to happen. The supply will no longer be as much of an issue as there'll be other issues, other concerns around, are people willing to take vaccines? How do we administer the logistics of vaccines? But right now, those supply constraints mean that we're really needing all of you to continue to be patient. While it's your turn, when it is your turn, don't hesitate, vaccinate. But the second message and the most critical message is please help others in getting vaccinated as well, especially seniors and those who may have difficulty getting to vaccine sites. Please do whatever you can. We have 3 vaccines that are safe, they're effective, but we need your help in making sure that they're in the arms of Washingtonians. And we can't do that without all of you. So thank you so much. Let me, Corey, turn it back to you and we can turn it to Michelle then.
Thank you, Secretary Shah. Next, we'll go to Assistant Secretary Michelle Roberts.
Well, thanks, Corey, and thank you, Secretary Shah. I'm Michelle Roberts, and I lead the COVID-19 vaccine planning and distribution team for the Department of Health. I want to begin by expanding on some of the vaccine numbers in our state. As of March 29th, more than 3.3 million doses of the COVID-19 vaccine have been given out in Washington. Across the state, we've administered approximately 83% of the roughly 4 million doses delivered to our providers and long-term care programs. We're constantly surpassing our goal and vaccinating nearly 56,000 people on average every single day. Our 4 state-led mass vaccination sites are doing incredible work. Since opening on January 26th, they've given out more than 160,000 doses of COVID-19 vaccine. And on top of this, yesterday, the state's first federal mass vaccination site opened in Yakima. That site alone is ramping up to administer about 1,200 doses of vaccine a day for the next 8 weeks. We've made incredible progress over the past few months, and I want to start today by sharing more good news. A study published by the CDC shows people who got both doses of Pfizer or Moderna vaccine were 90% less likely to get COVID-19. These statistics are remarkable. They prove our vaccination efforts are working. The study also shows people who got 1 shot were 80% protected after the first 2 weeks. Researchers followed nearly 4,000 healthcare workers, first responders, and other frontline workers who had a higher than likely chance to be exposed to the virus. These findings verify vaccines protect us in the real world. On top of that, we've got some great news to share for parents and guardians. Pfizer made an exciting announcement this week that aims to protect our kids. The company says studies showing the Pfizer vaccine is safe and extremely effective for kids aged 12 to 15. In fact, the trial, which followed more than 2,000 kids, found Pfizer to be 100% effective for that age group. Pfizer plans to submit these data to the FDA to request expansion of its emergency use authorization. As a reminder, the FDA review process includes an independent analysis and review of the manufacturer's clinical trial data. A Western States Scientific Review Committee will also do an independent review of the data. If everything goes well, this could mean vaccines for kids 12 and older as soon as this summer. As a parent of a 12-year-old, I'm looking forward to the day I can protect my daughter from COVID through vaccination. This brings me to my next topic, vaccinating 16 and 17-year-olds. Some teens in this age are eligible now, and all of them will be eligible in just a couple of weeks on our Vax Day. Currently, Pfizer is the only vaccine authorized for people age 16 and 17. Moderna and Johnson & Johnson are authorized for people age 18 and older. When you're scheduling your appointment, head to our vaccine locator website, find a location, and make sure the provider administers the Pfizer vaccine if you're scheduling an appointment for a 16 or 17-year-old. Those under 18 will need consent from a parent or guardian unless they're legally emancipated. And speaking of our vaccine locator, it's a great one-stop shop to check eligibility and find a vaccine provider near you. This is one of the things we're doing to make it easier for all Washingtonians to get vaccinated. In fact, just yesterday, over 163,000 people used the tool and 70% of them went on to make an appointment. That's just really incredible. As we've been telling you, Phase Finder is no longer needed to verify eligibility. Instead, if you're eligible, just head over to Vaccine Locator, so vaccinelocator.doh.wa.gov, and click on a provider and sign up for an appointment when you are eligible. Finally, let's go over vaccine allocation. And I have a graph to share. Could we get that pulled up? It's hard to believe it's already April and the start of the month is looking good as far as vaccine supply. Next week, we hit another record high for vaccine allocation. We're expecting to get close to 460,000 doses of vaccine in our state allocation. And that includes more than 100,000 doses of the Johnson & Johnson vaccine. You can see on the graph that we're closing the gap between the amount of vaccine ordered each week and the amount in our state allocation. That is just really a very promising trend, and we look forward to seeing that continue as our state allocation increases. So we have a lot to celebrate. We're getting more vaccine to the state, and starting April 15th, everyone aged 16 and older will be eligible to get their COVID-19 vaccine in Washington. Please share this good news with your friends, family, and community, and encourage them to get vaccinated to help us in this pandemic. And please reach out to family and neighbors if they're eligible for the vaccine and double check that they've been vaccinated and ask if they need any help to schedule a vaccine. As that's really a good neighbor thing to do, especially for our friends and family who may not be tech savvy. So thank you so much, and I'll turn it back to Corey.
All right, and I'm returning to Secretary Shah, I believe, had additional remarks.
Corey, only if the graphic is ready. If it's not ready, then is it ready?
Yeah, let me go ahead and share my screen.
Okay, well then, there you go. So this is what we've been talking about, the three-legged stool, that it's a careful balance of supply, logistics, and demand. And as you can imagine, if any one of those legs, just like a stool, if any one of those legs is imbalanced or shorter than the other or constrained, the stool is not as well balanced. It's always important for us to remember that we're going to constantly be chasing these three legs. At some point, we hope that all three of those legs are even keeled and we're all, we're on in the same direction. But as the team can tell you, and just incredible amount of kudos to Michelle and Lacey, I will say that we have been really pushing on that supply side. That has been our real issue. We've been talking to our federal partner, doing everything we can to increase the supply into the state of Washington. That has been the leg that's been shorter. And that means that the vaccine, the stool has not been as balanced. We do see that leg starting to increase in its length. And that's when we want to continue to make sure logistics, which right now we feel with all of our public-private partners out there, and again, thank you to Dan, that we want to make sure that the logistics from that standpoint are and continue to be sound. And I do want to give a shout out to Andy Rose on our team. Andy has been so incredible about doing various things to make sure that our system continues to be strong. But that third leg is the leg that we are equally focused on. Dr. Lindquist and I will tell you that when we are talking to patients, individuals in a room, to say, hey, it's important for you to get a vaccine for whatever vaccine it is, That is tremendously impactful as healthcare providers, whether it's a doctor or a nurse or a dentist or anybody else in the healthcare system. We need to continue to monitor the demand and make sure that the hesitancy or misinformation or myths do not drive people not to get or seek vaccine when they are eligible. So supply, logistics, demand, those are the three legs of this stool. Ultimately, on top of it is the vaccine, right? And, it looks like a pill bottle here, but I'll tell you it's a vial. And that vial is, as long as we have a good balance, it won't tip over and we won't drop the vial. What we're going to have is a well-balanced system. And that's what we're continuing to work every single day to achieve, is a well-balanced system. But we're going to need everybody's help. And we've already gotten help from our federal partners on the supply side. We're needing everybody's help on the logistics side, and we're getting that from our state and local partners. And now we need to continue to make sure we emphasize the vaccine demand. And by the way, vaccine demand isn't just about hesitancy, it's also about access. It's about people just not being able to get there. And so our goals of numbers absolutely must be balanced and are absolutely critical to also making sure that equity is part of that conversation. And it is forefront in our minds. And I want to make sure we emphasize that. So Corey, thank you so much for that opportunity. And with that, is there anything, Dr. Lindquist, Lacey, or Dan, anything that you all want to add before we go to Q&A? Okay, Corey.
All right, this brings us to the Q&A segment of today's briefing. We have a number of reporters in the queue today. For our panelists, you're looking at 6 to 8 questions. And we do, because of that list, want to encourage folks, if we're unable to get to you, or if you have a follow-up, please reach out to our public information desk at doh-pio@doh.wa.gov. And we'll begin with Will from NPR.
Hi there. I'm just curious. Obviously, the public health guidance has always been to get whichever vaccine is offered. But now that there are 3 and we're going to have more supplies available, are you going to be giving people a choice when they show up to a site? And do you have a sense of whether people are kind of choosing certain vaccines over others?
Let me make a global comment and then I'll turn it to Michelle on that. And the global comment is that, look, all 3 vaccines are safe. All 3 vaccines are effective. There's one of those 3, which is the J&J vaccine, Johnson & Johnson vaccine, which is 1 dose. So there are some benefits of having a 1-dose vaccine, especially with certain communities, certain populations, places where it's hard to get back a second time. So there are some reasons to potentially try to push vaccine that's a 1-dose vaccine to certain areas or certain types of sectors or modalities like a pharmacy or a community health center. But the critical piece for what we've been saying throughout, and we're going to continue to say unless we see any evidence that we should say it differently, is that all 3 vaccines are effective and safe. And so it's really about where you go. If you go somewhere and they're offering the Pfizer vaccine, guess what? Get it. If you go somewhere and they're offering the Moderna vaccine, guess what? Get it. If you go somewhere and they're offering the Johnson & Johnson vaccine, guess what? Get it. The point is that our message is that all 3 vaccines are safe and effective, but the most important piece about a vaccine is the vaccination, is to make sure that it's actually in the arms of a person and not just somebody hesitating or waiting for the perfect vaccine. The perfect vaccine is the one that is given or available to you. Michelle?
Yeah, I'd say the best vaccine is the one that's available. And as far as when you are scheduling, is to understand what's being offered at each site. Many of our scheduling tools, including the tool called PrepMod that the state has offered to providers to use, and we're using in many of our state mass vaccination sites. It will tell you what type of vaccine is available. So there is some information ahead of time, and most sites in one vaccination clinic will not be offering more than one vaccination at a time, or more than one type of vaccine. There's just not supply for that yet, for providers to have multiple types of vaccine on hand and be able to give the public a choice at this point. And really what we're doing, it's a race against time, against our disease levels, against the variants. And so once again, we want people to be vaccinated when they are eligible and when they're offered a vaccine. That is the most important piece. So again, the best vaccine is the one that's available to you.
Our next question comes from Pablo with Univision.
Hi, thank you. I'm looking at data in your dashboard. It appears that only 5% of fully vaccinated people of all ages are Hispanic. What do you think is the main obstacle that this population is facing in order to get vaccinated?
Yeah, Pablo, thank you. As I mentioned at the beginning, or at the very beginning and then at the end about equity, we really start and we close with equity, and throughout the whole process, there are a number of factors, and our team is constantly working with partners on the ground to make sure that we remove any impediments, any barriers to any population getting vaccinated. So no matter who you are or where you live in the state of Washington and you're eligible for vaccine, after the 15th of April, anybody above the age of 16 or above, we want to remove those barriers. And so some of it can be just as simple as not fully knowing how to access the system. Some of it is maybe misinformation or myths that may be perpetuating in certain communities across Washington. Some of it can be language and linguistic, cultural barriers that may be in place as well. Some of it is lack of comfort on how vaccines are offered in certain settings. And that's why we've taken a multimodal approach that, we do know certain communities may not want to go to a certain kind of setting, facility. In other communities, or other settings, they may be more comfortable. We want to make sure that all of that is available to all populations. And so I think with our Latinx communities, those are the kinds of things that are really in our minds, that are important. But I do, Pablo, want to make one quick comment, which is really about just the caveat of being careful of measuring the denominator, if you will, of where we are currently. Because remember, the eligibility thus far it's been health workers and long-term care facilities, it's been seniors, and we have only recently been able to open up to other populations. It is going to be important for us to continue to monitor this as we open up to all Washingtonians beginning April 15th, 16 and above, because that's when we're going to start to really measure the denominator of the entire population of the state of Washington for a number of different racial or ethnic groups with who has been vaccinated. So we have to also keep the context in mind on who's been eligible thus far to the journey of who's going to be eligible starting April 15th moving forward. And that's why I meant about the last 4 months, but also critical to what's coming up in the next 4 months.
Our next question comes from Maher with KXLY.
Hi, Dr. Shah. I'm wondering, that graphic you guys showed of what people can now safely do after being fully vaccinated. Some people may see that and think that's not enough after a year of being locked down. What incentive and kind of hope can you share to those people that may change soon?
Yeah, Maher, thanks for that. I'll give you the context, but sometimes I'm not the person to give you the positive from it as well as Dr. Lindquist or Lacey can. So I'm going to ask the two of them to weigh in, but let me just make this comment, which is the vaccine experience right now is as much as we made progress, it's still 1.2, 1.3 million Washingtonians who've been vaccinated, right? So what we want to make sure is that we recognize is that it's not about where we are today. We still have a lot of work to do to get the rest of Washingtonians vaccinated. So the issue is, so for example, folks have been asking about, well, I don't need to wear a mask, right? Because I've been vaccinated. It's more than 2 weeks later. I can take my mask off and do all sorts of things, especially in the public square. And what we're trying to say is, look, we don't know if the person next to you is vaccinated, or the third person, or the fourth person, or the fifth. And the chances are they likely are not, because we don't have enough vaccinations that have occurred throughout the country. So that's one message. The other message, which I think is also absolutely critical, is that we know that vaccines are safe and they're effective, but they're not 100% effective, right? Even the best of the best was 95%. So that means there's still 5% that you could be vaccinated and still be able to get infected with COVID-19 and transmit to someone else. And, we did provide data earlier, and, Dr. Lindquist can speak to it about vaccine breakthroughs. I know he did a number of media interviews yesterday on this issue. So we know that vaccines are not foolproof, but they're pretty good. They're really good. They're very good. But that means that we want people to really do the things that they can do. Now, when we get to a point where markedly more people are vaccinated, again, months from now, it's a very different proposition. But today, we're still at a point we just don't have enough vaccines throughout in the arms of Washingtonians. Dr. Lindquist, Scott, Lacey?
Yeah, I'll go first. I think the real obvious thing is folks that get vaccinated, even if they have breakthrough, they have much less severe disease. So that is just the very blunt benefit of getting the vaccine. And for me, that's good enough as a individual. But I do think it is a little disconcerting. You got vaccinated, you want to travel, you don't want to wear your mask. For all these reasons that Dr. Shah just outlined, as we are getting more and more of the population vaccinated, it's better. And I shared this last week. I want to go on vacation. I'm fully vaccinated. I want to go to Iceland. I want to go to Sweden and Iceland. But what we're starting to see is in the travel industry, a little bit of loosening up for people. Believe me, I'm not going to Iceland anytime soon. But I can now travel to Iceland from the United States if I'm vaccinated. So those are the kind of stipulations we're going to start seeing in the travel industry. We're going to start seeing this emergence of things like a passport for vaccination that allow you to access certain things. These things will start to slowly open up, and those will be the benefits we'll see. But as Dr. Shah outlined, while we're in this current state, we are starting into a new phase of this outbreak. We're starting to see increased cases. We need to be conservative. So even though I've been vaccinated, I fully understand I need to wear a mask. I need to still social distance. And I really shouldn't be traveling to Iceland until this pandemic has calmed down. Now, you can't go to Sweden right now very easily. I mean, you could go, but the incidence is high. So I wouldn't travel to Sweden. The only place I could go is Iceland. But again, my own advice is don't travel unless it's absolutely necessary to travel. And I know that's a hard message to send to a bunch of folks who want to go on spring break, but truly we are seeing cases in vaccinated people that are breakthrough that have done just that, traveled to spring break, etc. So I would add a little caution to this.
I'll just be really brief. I think that Dr. Shah and Dr. Lindquist covered this really well. To give numbers to one of Dr. Shah's points, we have 16.9% of Washingtonians vaccinated. That means 82.1% of us, I think if I'm doing my math right, 83.1% of us are susceptible. And as Dr. Shah mentioned, the more of us that get vaccinated, the less risk there is to all of us. So as the summer goes on, you'll see more opportunity for vaccinated people to do more. You'll see more flexibilities in some of the health and safety guidance that we have put out, or the governor's office has put out, or that CDC puts out. But we're still really focused on winning the race between the vaccines and these emerging variants and a potential fourth wave. And given where disease rates are right now, we are really asking Washingtonians to double down on those 4W behaviors. And when your turn comes up, get in line and get vaccinated.
About 6 reporters left in the queue this morning, and so we will go to Arielle with the spokesman.
Thank you. There are about 38,000 people who've been vaccinated in the state whose county of residence right now is listed as unknown. So I'm curious what's being done at the state level to clean up some of that data around who's getting vaccinated, whether that be their age, their county of residence, race and ethnicity. What's being done to clean that up, and do we have a timeline for when that data will be accessible by counties to sort of start targeting hesitancy?
Great question, Arielle. Thanks. Lacey, Michelle, that maybe, if you don't mind.
Yeah, I would say the data is always just going to be as good as the data that's submitted by healthcare providers. So we can't go back and create a county for somebody that information was not submitted by a healthcare provider. So we're working all the time with healthcare providers on data completeness. We're looking at information like things like where is there problems by trends by provider? So is there a certain provider where there's more county of residence or maybe more race ethnicity data? And then following up to with those providers or with where we're seeing any trends to address that. As far as making data available to the counties, there's an incredible amount of data available to counties right now. So all counties need to do is sign a data use agreement, and they have access to much more of the kind of behind the scenes data, so they can do their own analysis and identify trends and things going on in their communities. So they can use that data to drive their decision making, drive their outreach. So that's been happening, and it's been happening for quite a while.
Our next question comes from Jessamine with Q13.
Good morning, and thank you all very much. Yesterday, you guys talked about with Governor Inslee, 28% of seniors without a single dose. And Inslee seemed to imply that this was due more to hesitancy than appointment availability. And I'm wondering, with 2 weeks to go until mass eligibility, are there special measures being taken outside of encouragement? And you had mentioned an upcoming announcement from Sound Transit, and I'm wondering if you're able to expand a bit on that at this time.
Yeah, thanks. Actually, I think Dan Laster, who's on, also has an additional comment that he wanted to make. So I'll turn it to Dan. What I would say is from yesterday's press briefing, it was clear that what the governor was saying and what I was saying alongside with him is that there are a number of factors that go into why we don't have all of our seniors vaccinated. Hesitancy is one part of it. There's access issues, which is why we've talked about the phone number. We've talked about other means, for example, what Dan is about to talk about as well for transportation. It's just really, it is very complex. But again, supply, logistics, demand. It's not that you focus on each leg separately. You go, oh, we'll focus on demand in 3 months. No, we focus on all three of those throughout, but there are the different constraints that are more so the issue. Right now, we do see that because of the supply constraints, there's far more demand than there is the supply, but eventually that will change. But there is probably likely some masking of even hesitancy in all populations and all groups throughout the state of Washington. So we just have to continue to fight this fight, and it's an important one. Dan?
Yeah, thank you. First, can you hear me? I want to make sure that, yeah. So 2 comments. One is VAX is very focused on partnering across to make it easier for all Washingtonians. Obviously, the vaccine locator tool and the call center work is all about that. In the area of making it easy once you've got an appointment to get to an appointment, we really are delighted with our partnering with both Pierce County, Pierce Transit, and Sound Transit, who have amazingly offered for free rides to and from vaccine appointments. I also just wanted to add, in response to Pablo's question on the issue of reach to the Latinx community, very much acutely aware of the challenges. And obviously, as Dr. Shah said, there's no one approach. It's many approaches, but to give you an example of the kind of things we're doing, literally just yesterday, we're partnering with a volunteer group, Adios COVID, and they're focused on the Latinx community. And our technology team literally is in the process of building an electronic communication, which will allow that group to send text messages to the Latinx community about proximate geographic appointments. So it's one, obviously that's only for those who have digital access, but there are many things underway. Just one other example, we are hopefully this week or next going to be publishing a resource guide for community-based organizations where they can utilize private sector resources for free to help the community-based organizations, including, of course, Latinx community-based organizations, reach their community to help them get mobilized and get vaccinated. Thanks.
Thanks, Dan.
Our next question comes from Nicole, Cairo.
Thank you so much for taking my question. With the rest of our adults coming eligible on April 15th, how are you going to keep the system from getting completely overwhelmed by the onslaught? I'm picturing kind of like when everyone at a party immediately gets up to go to the buffet table, or, you know, what happens to Ticketmaster on the day that Hamilton tickets go on sale. I mean, how are you going to keep the logistics of that from just completely collapsing with all of a sudden every adult eligible? And realistically, how long are we going to have to wait to get that appointment?
Well, Nicole, thank you. There are a couple of questions you've asked there. One, I would say that we've been really been doing this throughout this process for the last 4 months. Is really, initially, again, as Michelle showed on the graph, the supply and the in terms of the allocation and the provider demand has been even more so of a gap earlier in the process, and yet it's starting to close that gap, although we still have it. So I think a couple of things is, one is that we want to continue to remind our providers of the importance of what we talked about, people that we are absolutely focused on. All the people that are in the prioritization groups thus far still are, they were in those groups for a reason. They were in those groups because we were concerned about risk. And so those individuals continue to remain eligible. We do recognize that there's going to be an increase in people throughout. We're going to ask people to continue to, like, look, if I'm a younger person and I don't have any health conditions, but I've got my aunt who's got, she's older, she's got a couple of health conditions, and I'm trying to figure out if I'm going to get her vaccinated for an appointment set up, or if I'm going to do myself. We're going to ask you to get your aunt vaccinated. I mean, these are the micro decisions on the ground that we want people to help us with. We want people to recognize that still there isn't enough supply. It doesn't magically open up on April 15th. But what it does show is that we do believe that moving forward, what we don't want to do is that when supply does increase, all of a sudden now we're trying to figure out how to open up eligibility to people across the state of Washington. We're also watching what's happening across the country and how other states have moved in this direction. There are a number of states that have already done this, and we're also looking at their experiences. And then the last thing I would say on this is that it's also working with our providers. Our providers are also holding some of those appointment slots, so for certain populations, certain groups, and that they also can prioritize within their systems as they feel appropriate. Again, knowing that people are going to be eligible, but also recognizing we won't have enough vaccine supply. Michelle, did I miss anything?
The only thing I just want to add, it's actually a smaller group of people on April 16th and are already eligible. So right now we have 5 million people eligible in our state, and there's about 6.3 million estimated population that's 16 and older. So hopefully we're going to have people always kind of coming in, and that we'll need to catch up. There'll be the early adapters, and there'll be people who will need a little more time because of just when they can get in to make an appointment, or maybe they need more information to have a choice to be vaccinated. So The good news is it is this kind of the final group that's coming in on April 16th. It's not opening up to 6 million people on that day. 5 million people are already included.
And just real quickly, I appreciate the Ticketmaster concert analogy. I do want to mention, when that group becomes eligible, and even now, providers are, it's not everything goes live at midnight. They're adding appointments throughout the week. So if you log in on Sunday and there are no appointments, log back in on Monday. It doesn't mean that the appointments are all booked forever. So appointments get added by different providers in your community throughout the week in real time on the vaccine locator. That means if you want to, you can sleep in. Just figure out different times of the day and different days of the week to check the system.
And just to clarify, Michelle said April 16th. I think she meant April 15th. Yeah. Corey, back to you.
So we have 3 reporters left in the queue. I think we can accommodate everybody this morning. So we will jump to Ruby with KUOW.
Hi there. Thanks for taking my question. And it's pretty similar to a question that was raised earlier in terms of the 65 years old and up who are not, who are still not vaccinated. What is the estimated number and what's the reasoning behind that? And I'm also curious, is there like a gender divide or a geographical divide for that matter?
I'll have to turn that over to Michelle. I did want to make one comment, which is that 65 and over, but remember, yesterday we also opened a 60 to 64. So I do want to recognize that when we look, and Dr. Lindquist can go through this if you need it, but when we look at risk from an age standpoint, it's really that 60 and up where the risk is in terms of what we've seen throughout the pandemic. So it's 60 and up, in addition to obviously the 65 and up who have been eligible thus far. Michelle?
I can jump in the number
okay,
if it helps.
Yeah.
It's about 330,000 people over age 65 that have not yet had a dose of a vaccine. I think you heard earlier, there are multiple reasons behind that. In terms of gender and geography, there are some differences in geography. There are a few more rural areas of the state where the rates are a little lower. I'm not aware, and we could potentially follow up on if there's a significant difference in gender.
Thanks.
Yeah, I did just pull up. Am
Go
I
ahead.
unmuted? Yeah, sorry, I was having a hard time before. I just pull up some of our internal dashboard. It does look like overall that women are more likely to be vaccinated than men. And so as a state, we have about in the high 50% of women who are vaccinated. And for men, that's hovering around kind of in the low 40s. So there is some gender discrepancies. Which is not surprising around healthcare seeking behavior and other things. Those trends often play out in healthcare seeking behavior. So women are often the healthcare decision makers for their families and first to usually schedule appointments. So important message that we really would love to see those numbers be more even.
Michelle, just to clarify for Ruby on this question, above 65 by gender, can they see that on the website? On the external facing?
Yeah, let's follow up on that.
Okay.
I would need to pull it up before,
Okay.
but I was giving some overall
Okay.
gender details.
Thank you.
Yeah, I don't think we can. I don't think it's on our dashboard yet, but we can follow up with the data.
Okay, thanks. Corey?
All right. Our next question comes from Evan with the Seattle Times.
Hi, I'm Dr. Shah. I'm curious about the B117 variant. You mentioned that you're expecting that to represent about 50% of cases sometime later this month. The last variant report showed that the California variant was more widespread. Has something changed is B117 growing in importance, and and are variants what you all believe is driving the increased transmission at this point?
Yeah, let me just say your second question. Let me answer that, and then I'll turn to Scott on the first part. The second question is, we do think that is a part of it. We don't know how much of a part of it. I mean, we do believe that behaviors are also a significant part of this as well. And just the reminder that we're not out of the pandemic. And so there are some things related to that. But Scott, is there's going to be a report that's going to be released soon enough about this. So Scott, you can give some precursor to it.
Yeah, and Evan, it's a great question. The new report was just released this morning. It's on the web page. What we're talking about is we've had a lot of people really projecting that the B117 is going to be a significant amount. The difference between what people are expecting and what we are actually seeing will unfold over the next couple of weeks. So the variant report that is dated April 1st really shows that our largest percent of the genotypes that we have is the B1.2, which is a common variant. It isn't a variant of concern. You know, that's at around 38%, 37%. And that the next most common variant is the B1429, which is that California variant, and it's at 21.5%. So I think that's been the surprise. Everyone's thinking this B117 is going to become the predominant strain, and it might, but as we follow our genotyping results and become much more represented in our sampling, that variant report every week is really going to be insightful. So I think it's a really good question. Everyone is thinking B117 is going to be the main variant. What we're actually seeing unfolding slowly is the B1429, or the California variant, which I take to mean that you are actually looking at our variant report, which makes me happy that someone's actually looking at it. So hopefully that answers your question.
Our final question for today comes from Bellamy with KNKX.
Oh, hi. This was addressed to some extent already, but I'm just kind of wondering, as we look to April 15th with the increase in both availability of vaccines, but eligibility of people, you know, what are the main things that the state is doing in order to ramp up for that and ensure that the best possible outcomes will in fact take place?
Yeah, Bellamy, thanks. You know, I think it's understandable that as people see the milestone days and see, you know, things opening up for additional people, which obviously is what we've also been emphasizing, we have to remember that it continues it is a continuum. And all of the activities that we have been focusing on for the last 4 months continue to be in play. And then we continue to look at additional activities or issues or challenges that we need to address. And, you know, one of the biggest challenge I would say in this entire pandemic is that it certainly has been interesting. There has been no day that has been like the day before. There has been no week that has been like the week before. Every one of those changes or challenges means that we have to stay ahead of it or have to address it if it's something that, you know, that was unanticipated. So what we're doing for April 15th are a number of things related to one, again, think of the three-legged stool. One is about the supply, to do whatever we can to push with our federal partners to increase the federal supply. And remember, the federal supply isn't just what's coming into the state of Washington that Department of Health gets, but we're also recognizing that the federal system is also pushing vaccine into some direct streams. For example, the pharmacies or community health centers, et cetera. The one that just got added this past week are dialysis patients on dialysis. So constantly there's more vaccine that's coming in addition to the VA and the DoD and other, you know, streams. So that's the supply piece that we're continuing to do whatever we can there. The other is to work with our partners on the administration and the logistics side. And really that is so key with the Vac Center, our equity efforts to make sure that we are, again, no matter who you are, where you live, that you have access to vaccine. This is a process that so far we've been successful because we have, frankly, had supply constraints. But as the supply constraints come off and you now have more people eligible, then it really comes to, again, administration of those limited precious resources to be able to do that. And then finally, it is this, it is the demand piece to help us to temper the expectations. Again, to King 5 colleague who said, tax day is vax day. That's great. Absolutely. But it doesn't mean that sometimes you can't pay your tax on April 15th. You can't get your vaccine for all, 6 million people in the state of, the ones eligible in the state of Washington that can get vaccinated on Vax Day. So that means it's going to be a process. So what we're doing is all those things behind the scenes to make sure that we can work on supply, work on the administration logistics, and then we're going to ask you to help us work on the demand piece to make sure that people recognize that the right messaging is there, that people understand the limitations, that, like Lacey said, that they check back, that they're patient in the process, and that, to Dan's comment about user experience, that it really comes through, that there is not just the part about I got vaccinated, but they also have a positive experience out of that. And they do feel that that the state of Washington did everything it could to make that experience stronger. So we're really hitting on all those. And let me stop there, and anybody on our team, if there's anything they want to add.
Yeah, this is Dan. I would just, going to the logistics leg of the stool, that's where working with our private partners and also DOH, making the sites of various modalities really just amazingly well-run operations. Logistically, where on average, people, it's less than 30 minutes. Every aspect from wayfinding to registration, to getting vaccinated, to observation, making that as smooth as can be. And so in some ways, we've had this period where we've had the supply scarcity to just do continuous improvement, which is ongoing. So I do think one of the great things about the state of Washington is we do have leaders in logistics, and they've been helping the state at the local health jurisdiction level at the different modalities. So that piece of the puzzle, I think we are getting ready as well as we could.
I'll just quickly add, we do have multiple types of providers. There are the traditional vaccine providers that many of you are familiar with, primary care clinics, community health centers, healthcare organizations, hospitals, pharmacies, as well as mass and mobile vaccination clinics, employer-based clinics. We have more than 1,500 registered provider organizations in Washington state, and we're in regular communication with them about their capacity and readiness to move. And, in addition to their capacity, making sure they're ready to ensure those equity pieces that we've talked about earlier, so that we don't leave any key population behind when we open it up to all of the state. And really sort of stress testing and monitoring our capacity so that we vaccinate as many Washingtonians as quickly as possible and as equitably as possible.
Yeah, that was the thing. I'm glad you mentioned that, Lacey. I didn't want to not mention, ensure we mentioned some of the equity strategies that we're really working on to make sure everybody has access to the vaccine and has information they need that's culturally and linguistically right for them, help them feel confident in their choice to be vaccinated. And so part of that work includes investment in community-based organizations, and that's really fiscal investment. So they can help us do a number of things, including helping schedule appointments for people, help share information, help do community-based outreach and education from community leaders speaking to their peers and their community members. So that's a big piece of what we're doing. in addition to really helping with some equity approaches for providers, including partnering with community-based organizations for filling those spots. Collecting, there was a question earlier, making sure they're ensuring they're collecting the race and ethnicity data about the people who they're vaccinating. So lots of different, there's 8 different vaccine equity strategies for vaccination that are available on our website to give more in-depth information about the strategies we're doing.
And on second look, I did miss one reporter. So we'll go to Steve with Como for our final question today. Sorry about that, Steve.
Not a problem at all. Thanks for the time, you guys. I have 2 questions for you. I realize that vaccine allocation projections from the feds are subject to change, but beyond next week, do you expect those numbers to continue in that going up trend, or are they going to drop back down again? The second question is, what do you tell people who live in counties that, as of right now, would be in danger of falling back one phase if the metrics were to be reevaluated today? I realize April 12th is only a week and a half away. Is that really enough time for some of these counties that are in the quote unquote danger zone to turn things around?
Yeah, let me take that second piece, and maybe Lacey or Scott want to add to it, and then Michelle, if you could talk about the supply piece. Look, the message to everybody is exactly what we've said throughout this press briefing, is that we're still in this pandemic, and if we let our guard down, or the concern about the race against variants, that you can absolutely not just see the plateauing, the flattening, but you're going to see increase, you're going to see upticks, you're going to see, a potential 4th surge, and that can then be demonstrated in counties that would then start to be above that threshold, and that is the concern. And so, regardless of where your county is at, whether you're not in danger of that or you are in danger of that, I would say the message remains the same. Do the things that you can do. Make sure you encourage the people around you to do the things that they can do to be able to fight this pandemic. Wear those masks. Do all the 4 W's. But it's also about the testing piece. And I think that's one, Steve, one thing that has continually, as people are focusing more and more on vaccines and vaccinations, people are forgetting the importance of testing. Testing, it continues to be critical to the process. And throughout this pandemic, I've said you can't trace without a case. You have to start with a test. And testing is absolutely critical. If you've been exposed, or if you have a symptom that is consistent with or could be COVID-19, we want you to get tested. So the message to everybody is that we are not out of the pandemic, and let's act like that. That's the key message. Lacey or Scott, you want to add to that, and then Michelle.
I think you covered it well. I think the main thing with the metrics is they are risk-based, based on burden and trajectory of disease. So if next week we announce that a county or some counties move to phase 2 because their disease rates are high, we recognize that will be disappointing for those communities. However, we really do need them to rally together, and they have a chance to move back to phase 3 weeks later. And the really important message here, I think it's hard as a human because your mind calculates risk in really complicated ways. But when you move from a lower phase to a higher phase, or a less open phase to a more open phase, we're allowing, as a state, more things to happen. But at the core, in order to do that, you still have to do all of the mitigation measures. You still have to wear your mask consistently. You still have to socially distance. Even though your brain is telling you, all of that risk is gone, we really need people in phase 3 to keep their guard up at the same level and keep discipline with those protective behaviors in the same way.
And I can just add the question about what's our 3-week vaccine forecast look like. We get updated forecasts from the federal government once a week, and that's kind of usually Tuesday afternoons or midday Tuesday to early afternoon. And what's been happening the last few weeks, it's been that Tuesday morning update that's showing the increase for the following week. So like we shared that yesterday when we got our updated 3-week allocation for next week, the allocation was about 100,000 doses more than they had told us the week before for next week. So I'm taking the 3-week forecast at this point with a little bit of grain of salt for the kind of week 2 and 3 out, because they have been continually showing kind of a decrease, but then the week of we get updated numbers and they're increasing. But like I said, next week's forecast is for about 460,000 doses, and then we do see a drop to around 400,000 doses for the following 2 weeks. But if the pattern continues, we expect to see those numbers likely increase. I'll also say, remember that these are just our state allocation numbers. There is many streams of vaccine coming directly into this state, directly from the federal government, including the federal pharmacy program, which we think is increasing to around 100,000 doses a week, community health centers, the Department of Defense and the VA, who are vaccinating veterans and active duty family members and active duty military members. So now Dr. Shah mentioned a direct stream to kidney dialysis centers. So there is a lot of vaccine coming into the state each week, and I think each week we will expect to see it.
Yeah, thank you, Michelle. Thanks, Lacey, and thank you, Scott and Dan, for being on today. I just want to close by saying again that we're not out of this pandemic. We have a number of things that are hopeful and give us hope for the future, including the April 15th announcement of, again, not tax day, but Vax Day, of eligibility for those 16 and over in the state of Washington. We're still limited by supply, so it's not going to be that day magically everything opens up to be able to get vaccine, but there is hope for the future that we'll continue to get increased vaccine supply. That said, it is absolutely critical in the next 2 weeks for us to do 2 things. One is to make sure that if there are people who are in those populations that are eligible right now, especially seniors and especially those who have not had access or been able to get access to vaccines, that we do everything we can as community members to help them get the vaccine. Please do everything you can to check on your neighbor, especially a senior, an older person in our community. You do whatever you can to be able to help them get vaccinated. That's the first message. And the second message is we've got a lot of these events and activities, everything in the spring to both graduation and obviously the holidays, Passover, Easter, Ramadan. We've got also the Final Four and Go Zags. But at the same time, please remember we're in this real delicate time, and we continue to be. And so please hold on, do whatever you can to help us by wearing your mask and doing all the things to protect each other, even while you celebrate responsibly. And that includes with travel and spring break. And so with that, thank you so much. We'll pick it up next week. And I really want to thank again, Michelle, Scott, Lacey, Dan, and certainly I want to thank Corey for leading us through this.
Thank you, Secretary Shah. This concludes today's media availability. I'd like to thank our panelists and of course, TVW and others for hosting today's live stream. If you're looking for past archives of these briefings, you can visit tvw.org. Thank you and take care.